Helicobacter pylori by Katana Fitzgerald. What is Helicobacter pylori? It's also known as H. pylori for short. It is a gram-negative microphiliac bacterium that is usually found in the stomach. This is a common bacteria that begins growing in the digestive tract and has a tendency to attack the protective lining in the stomach, causing the erosion of it. 30 to 40% of people in the United States get this infection. Majority gets it as a child. H. pylori outcomes are determined between bacterial virulence factors, host, and environmental factors. So in 4 steps, it is critical for bacteria to establish successful colonization, persistent infection, and disease pathogenesis. Once it enters the host, step 1 is that it needs to survive the acidic stomach. Step 2 is that it then needs movement to the epithelium cells by flagella-mediated motility. Step 3 is then attachment to the host cells need to happen by adhesions and receptors interaction. Last but not least, this step will cause the tissue damage of the stomach by toxin release. Who discovered H. pylori? In 1982, the Australian scientists Barry Marshall and Robin Warren were the ones who identified H. pylori when it was found present in a patient who had chronic gastritis and gastric ulcers. Doctors continued to dismiss their theories as they were convinced ulcers were only caused by stress. They were unable to test their theory on lab mice because H. pylori only affects primates. And they needed to prove that they were right to the doctors, and the scientist Marshall grew desperate and knew of only one human patient he could run the experiment on. It was himself. He took some H. pylori from the gut of one of his patients, put it in some broth, and drank it himself. After a few days, he did indeed develop gastritis, resulting in an ulcer, bad breath, and vomiting. He was able to biopsy his own gut, culturing H. pylori, and proved that this bacteria was the underlying cause of these ulcers. Peptic ulcers and H. pylori. H. pylori doesn't come with any symptoms until it has broken down the protective lining in the stomach. Once it has done that, it will lead to gastritis or a peptic ulcer. A peptic ulcer is when you have a dull burning pain in your stomach, much like acid reflux, especially so when you have an empty stomach. This pain can last minutes to hours, days to weeks. Not only is H. pylori one of the main causes of peptic ulcers, but it can also lead to stomach cancer as well. Gastritis is the irritation from the erosion of the stomach lining. It goes along with the burning raw sensation that a peptic ulcer has. How doctors check for H. pylori. Checking for H. pylori is fairly simple these days with all the growth in technology. There are 4 tests that they can do. 1 is the stool antigen test. This test is where a stool sample from the patient is given to the lab to test and see if substances that trigger H. pylori is present. This test can also be done to make sure the treatment that was given has been successful as well. Next is a stomach biopsy. This is where the patient is sent for an endoscopy for the biopsy to be taken of the stomach lining. Then they have a blood antibody test. This test is where they draw your blood to see if your body has made antibodies to H. pylori. If they do show up, that means you're either currently affected or you have been in the past. A urea breath test. Being H. pylori produces an enzyme called urease, which turns into an ammonia and carbon dioxide. You are given a tablet to swallow, and the amount of exhaled carbon dioxide is then measured. Preventing H. pylori. Researchers believe that it is spread by unclean food, water, or even contact with an infected person's saliva or other bodily fluids. Being there has not been a vaccine yet created for H. pylori, you may be able to prevent it by a few simple things such as washing your hands with antibacterial soap after using the restroom and before eating. Eat properly cleaned by washing the food thoroughly before using it in prepared food. Make sure you're also drinking water from a clean and safe source.